Hi everyone, today we're going to discuss how to use VO2 max, ratings of perceived exertion, and maximal aerobic speed for conditioning program. So what we're essentially going to do is draw in and really rely on our programming and periodization conversations that we've had and our previous work capacity conversation that we've had. And we're going to try to mix those two together using some of the periodization concepts that we use for resistance training, and also some of the physiology that we understand when it comes to work capacity and some of our energy systems and everything that's tied along with that. And then, as usual, we'll go on some other tangents as well. So first of all, let's define VO2 max. And excuse me while I read from the slides, but I just want to get us all on the same page here. VO2 max refers to the maximum amount of oxygen you can utilize during exercise. It's commonly used to test the aerobic endurance or cardiovascular fitness of athletes before and at the end of a training cycle. VO2 max is measured in milliliters of oxygen consumed in 1 minute per kilogram of body weight. But don't confuse VO2 max with lactate threshold, the point during which exercise where lactate builds up in your bloodstream faster than your body can expel it. When you reach your lactate threshold, you get that familiar burning or cramping feeling. You reach your lactate threshold at about 50 to 80% of your VO2 max. So keep in mind that your VO2 max is greater than your lactate threshold, because when we start hitting that lactate threshold and we're having those burning or cramping feelings, we can keep working, we can power through it. But that VO2 max, when we have reached the maximum amount of oxygen that we can utilize during exercise, that's when we're basically starting to get behind on our ability to recuperate or to utilize any energy that we have. So that's basically where we are topped out at. And if we can raise so much like in resistance training, if we can raise our strength levels, I think about that similar to sort of the roof of a building. The higher the roof of the building is, the higher the elevator or the amount of power output that we can have is. And it's very similar with conditioning or with aerobic work, is that the higher your VO2 max is, the higher your lactate threshold can be. So keep that in mind as we move forward. How do you test the VO2 max? There are predictive tests that do not include laboratory equipment. But if you're actually going to test that VO2 max, what you end up doing is you pinch the nose. So you clamp over an individual's nose and you get a hose in their mouth, and you try to get as much of their air that's being inhaled and exhaled to pass through that hose. There's also a heart rate monitor, and within the hose there are sensors that measure the amount of volume or the amount of oxygen that you inhale, the amount of air that you exhale. And the protocol for these VO2 maxes is that you're going to start with a base of movement, maybe walking or a slow jog. Let's say we're on a treadmill, and as you go from one stage to the next, that treadmill might go faster and it may incline as well. So the work that you're doing is going to be elevated. And so what you'll see is the heart rate is slowly going to rise up and the breathing rate increases. And eventually we're going to hit that VO2 max, which once again is the maximum amount of oxygen that you can utilize during exercise. A lot of times what you'll hear at that moment is a hyperventilation. Not just hard breathing, but you'll hear and see a spike in a respiratory rate, because as the oxygen is being utilized maximally, the body doesn't know what to do. It's trying to compensate. It's trying to get more oxygen in there. And also, the reason that when we're holding our breath, like let's say we're swimming laps in the pool, when you start to get that burning sensation in your body, it's not actually a drive or a need or a desire for oxygen. It's a buildup of CO2 within your bloodstream is causing a desire or a drive to start exhaling. And so keep that in mind, is that there's that balance between oxygen and CO2 within the body. And I think we talked about that a little bit when we were talking about breath work and proper breathing patterns and things like that. But yeah, again, so when a lot of times that we're burning, we're actually not trying to get more oxygen. We're actually trying to get rid of CO2 or carbon dioxide. Just something to keep in mind about sort of what's happening within the body. And as long as we're going on a little tangent about that, one of the reasons that when you travel to altitude, I'm currently in St. Louis, if I was to go to Denver later on today, what would happen to me basically immediately is I would start having to take more bathroom breaks, because the lower oxygen levels in the atmosphere mean that I've got a higher exposure to CO2. And one of the ways that our bodies sort of counteracts that is we urinate. We expel that through urination. So just kind of a random fact about that. But if you're ever going to compete at altitude, what you would want to do is either compete a handful of hours after arriving. So if you're in St. Louis and then you go to Denver, so big altitude variation there, you'd either want to compete on the same day you get to Denver, or you'd want to give the body, the recommendation is about a week. So you're going to go through some dehydration once you get there. You can go through some dehydration because of the increased urination, because of the CO2. And then your body's going to have a little bit of time to start increasing its production of red blood cells. And what that's going to do is sort of help counteract that, and it's going to give us sort of that altitude stimulation, which is then going to help us better absorb and transport oxygen within the body. And some scoring, just to sort of give you all an idea of some scoring, that the average sedentary male achieves a VO2 max of about 35 to 40 milliliters per kilogram per minute. The average sedentary female scores approximately 27 to 30. Elite male runners have VO2 maxes of up to 85, and elite female runners have up to 77. I also read that some world records have been made in the 90s. So basically some very hard workers with a combination of probably some interesting genetics have scored up in the 90s. How do we improve that VO2 max? Again, I apologize for reading off of the slide, but just want to keep us all on the same page here. So once you have actually, let's say you're actually able to get tested, or perhaps you're going off of a correlation test, and there's correlation tests that you can get on a treadmill and do correlation tests with no equipment strapped to your face at all, and you just do the running protocol. You can do step-up tests, just various sort of challenges like that. But once you've got a number to work off, whether it's real or it's estimated, one of the best things that you can do, pardon my awkward silence there, is getting caught up. One of the best things that you can do is interval training. And let's keep that in mind as we move throughout today's presentation, is that interval training, which sort of helps our bodies get to sort of that redlining, higher end workload or intensity, is going to help raise our VO2 max. And again, just like we've talked about so much so far in this program, with resistance training, where strength is sort of the roof of the building and power is the elevator within it, our VO2 max is going to be like the roof of a building, with our anaerobic threshold being sort of that elevator underneath. And the higher your roof is, the higher your elevator can go. So let's dive in a little bit here on this anaerobic threshold. So our aerobic threshold, and if you look at the bottom there, some typical heart rates that are associated with different stages of our blood lactate concentration. So at 150 beats below, we're usually in an environment where we can last quite a while. For a trained individual who's not having perhaps like acute muscle fatigue and is able to just produce longer bouts of work, your aerobic threshold is essentially going to be 150 beats, heart rate beats per minute or less. And you'll be using a certain energy system there. You'll be using glycolytic and oxidative, right? If we remember those from our past conversations. And as we kind of break past that 150 beats per minute and maybe up to more like 165, you're going to start to enter that anaerobic threshold. If we see on the chart there, that red line, as it starts to take a spike upward, that blood lactate concentration is also going to start spiking upward. So again, remember, even when we're starting to have cramping and burning sensations, that doesn't necessarily mean that we can't keep working. We can work past that, and we can absorb and utilize oxygen in our bloodstream at levels that are higher than that. But at some point, we do hit a wall, and we hit our VO2 max. And essentially, that's going to be, who knows exactly where your heart rate is at that point. It may be 185 beats per minute, maybe higher. But at some point, we are going to be working harder and utilizing as much oxygen as we can. And then we're not going to be able to get rid of enough CO2. So when we're having a lot of burning sensations, that may be one of the reasons why. So just a reminder, as we look back at this RPE, and which works great for strength training and resistance training, but it can also be used for conditioning and work capacity training. So if you look on the Borg scale on the left there, the 6 through 20 scale, well, that initially that seems like a couple of random numbers to have as the top and the end of your scale, or the beginning and the end of your scale. But what it really is reflecting is that 6 is about resting heart rate about 60 beats per minute. So your lowest number on that scale is going to be basically how you feel sitting on the couch or driving in your car. You're just relaxed and your body's not doing very much at all. Whereas the 20, if you put a 0 on the end of that, that's going to be about 200 beats per minute, which for many individuals is going to be at or near maximal effort and maximal heart rate. So that scale is going to be pretty applicable based on some of the things that we're looking at here, as far as your exhaustion level and just thinking about your abilities in relationship to maybe your heart rate, in relationship to your ability to utilize and process oxygen within the body. So when we start looking at it that way, that Borg scale is actually going to be pretty useful. So if we don't have heart rate monitors or we don't have VO2 maxes to go off of, that's going to start to give us some better information. So now that we know what VO2 max is, and we know what RPE is, or we've been reminded what RPE is, let's talk about MAS or mass or maximal aerobic speed. And I apologize, but I'm going to grab a sip of water before we read off this slide again. Here we go. Maximal aerobic speed is simply the lowest running speed at which maximum oxygen uptake occurs. It's typically referred to as the velocity at VO2 max. Max was developed for the purpose of increasing the specificity of training and to enable coaches to monitor training loads more accurately. There are many tests which can be used to measure an athlete's mass, but for many, corrective equations must be used to accurately determine their mass. Coaches need to understand the difference between these common aerobic tests and the corrective equations if they are to accurately measure mass and the prescribed training based on this information. So that description might not be perfect. That definition might not be perfect. Let's go a little bit deeper and see if we can sort of clarify just a little bit better. So looking at maybe our VO2 max over here compared to our maximal velocity. Now, if you've ever performed or witnessed a VO2 max test, again with the clamp over the nose and the hose strapped in the mouth, you'll notice that individuals on the treadmill, it starts out slow and it's got a good safety protocol where it warms them up and takes them up and increases the incline and the speed. And by the time an individual starts to reach their VO2 max and hyperventilate and struggle to process more oxygen, they are running kind of fast, but they're not running at a full-out sprint. Especially many of our younger athletes, they're capable of much greater work output, but because of the duration of the test, at the time that they're running, they're already fatigued a little bit. They're already a little bit behind. So beware that your VO2 max, so this gap right here, that anaerobic velocity reserve, that gap right there shows that we're capable of running faster, but over time, we're just going to fatigue. So that's a reason that people don't do all-out sprints for marathons, right? That's just a little bit of logic. So just want to remind everybody of that and explain that a little bit more, is that this gap, so this gap right here, a lot of times we could be running faster, but that would make us hit a wall a little bit sooner, right? Or we might not reach our VO2 max, but we might have a different energy system breakdown or other issues that pop up that prevent us from working harder. So here is where we're going to reach our VO2 max. And it's going to happen over time if the body is in good enough shape to manage the workload. But if you look back and think back to one of our earlier slides, one of the best ways to train that VO2 max is to train with intervals. We want to come up here and be playing with fire and be spending time around our upper workload space. And then we want to do some recovery time that's going to allow the body to recuperate and regenerate and then prepare to go again. And with that interval work, that's going to help us raise that VO2 max. So it may not raise our maximal velocity, or maybe it does. That's going to be more on sprinting and speed work, which is coming up in the near future in this program. But that's something different. That has to do with your muscles, your energy system, your technique. This is about how much oxygen we can utilize, and has to do with more about our work capacity or your typical conditioning. So how do we assess mass? So looking here, one of the easiest ways to do it, and again, not everybody can run, but most athletes can, and this is one of the lowest common denominators, is just to take athletes out on a track and run them. And with a challenge of 6 minutes, let's say an individual covers 1,500 meters, You would then take 1,500 meters divided by 6 times 60, or 360, or excuse me, yeah, 360, pardon me, 3,600. You would then take, 6 times 360. Sorry for the math snafu there. So you then take 1,500 and divide it by 360, and you're going to get 4.2 meters per second. And you now have from the run, you now have a mass score of 4.2. And this would be similar to, in strength training, the 1 rep max. This does not mean that is your velocity maximum, because you could sprint faster than 4.2 meters per second, but at a shorter distance. And that's not your limiting factor there would not be oxygen. But at the 6-minute level, with this sort of test setup, your limiting factor tends to be oxygen. And that ties into relating and correlating to our VO2 max and our oxygen utilization. So this is not necessarily speed work. This is maximal aerobic speed, not maximal speed, not sprint, not anaerobic speed, because other events, such as the 100-meter dash, that's an anaerobic event. You may be breathing hard during it and afterwards, but your body's not actually utilizing oxygen to get you from the 0-meter mark to the 100-meter mark. There's not enough time. That's not how our bodies work. With this test, that's how it is. That's how it is working, and that's what the limiting factor is. So with that mass score, let's start to think about that a lot like a 1 rep max for our resistance training. And just another tip here, if you're going out and testing a large group, you can, instead of just doing 6 minutes and seeing how far they go, you can do a distance that they have to cover, and you can perform a very similar equation. You would just say, okay, they did this distance of 1,600 meters by time and divided by time in seconds, and then you get a mass score there as well. If this is sounding complicated, I will warn you that it can be intimidating, but once you practice it a little bit and go through it a few more times, it actually is quite simple. So if it's seeming confusing, I apologize, but I would encourage you all to stick with it and to hopefully try it out. All right, so looking at this chart here, I've drawn that little red box to indicate where our 100% mass score is. And that's what occurred during that 6-minute test. And that would be very similar to going in the weight room and maybe hitting a rep for 1 on the back squat. And whatever weight you did, maybe it was 200, maybe it was 400 pounds, that becomes your 1 rep max that all of your other equations are trained off of. So by only maybe testing 1 time, we can then start to program off of that. So we only test that 6-minute run 1 time, and whatever score it gives us, how many meters, your average meters per second, you can then program for harder runs. So let's say you did a 6-minute run and you want to start programming interval work, because remember, intervals are one of our best ways to raise our VO2 max or our ability to utilize oxygen. Let's say you did a 6-minute run, but you decide you want to program for 1-minute intervals. So if you're programming for a 1-minute interval, you're probably going to want to take that VO2 max and multiply it by 160%. and that would give you the maximal workload for a 1 minute interval based on your 6 minute run. And in similar fashion, if you were going to slow things down, you would actually do a sub-maximal amount of 4.2 meters per second. And that's how you would get a challenge for, let's say it was a 15-minute interval. You would then decrease the load accordingly. Now, keep in mind that backing off and going slower and longer can be good for us. It can be healthy. They can fit in and be part of the game plan. But most of our work is going to be done on the higher end portion because that's how we want to develop our VO2 max. We want to be playing with that redlining of our anaerobic threshold. So there is our VO2 max, a refresher on RPE, and a look at MAS or mass or maximal aerobic speed. And I would remind you and maybe encourage you to go back and revisit the work capacity presentation that we had in this program. Also, our periodization and programming discussion that we had. So looking at maybe a typical mesocycle, remember that mesocycle is limited. It's related to our general adaptation syndrome by Hans Selye. And that's a better way of programming if you're sticking to linear programming and you're doing a single month or 4-week mesocycles. And remember, there's many ways to skin the cat, but that's in this program, that's the sort of program that we've been revolving around for many of our discussions. Remember that 4-week program works really well for strength and resistance work. But when we start moving into our aerobic workspace and we're doing more conditioning and work capacity, there's several reasons why we may not want to do just 4-week programming, or really 3-week programs. The resistance and the stress on the body is not going to be as great. The tissues and the energy systems worked are going to have much greater regenerative capacity, especially if you're not always running, if you're mixing up your modalities. That can really save the joints and save the nervous system. So for those reasons, we have a lot more flexibility with what a block might look like. Coach Joel Jamieson recommends 8-week blocks. And again, just a reminder slide from our work capacity presentation is that we have several different options for how to approach our training. Again, shorter and more intense will better allow us to perhaps raise that VO2 max, but the work done in the longer and slower work that's done has benefits as well. And just pulling out a slide from before in our work capacity presentation, just remember that while we may have hard numbers and hard data to go off of and strict parameters, oftentimes we can also check in on our athletes, and the science shows that their perceived exertion and how they're feeling on a given day is also a productive and efficient way to measure and gauge the intensity of programming. If the numbers tell us, if maybe their VO2 max tells us that this is supposed to be almost an easy recovery day, but maybe the athlete has had a couple bad nights of sleep and they're dehydrated, and who knows, maybe they're under stress, they're fighting with their spouse. What was supposed to become an easy or recovery session may actually become a session with a really high heart rate and be in the red zone. So checking in with our athletes and taking multiple factors into consideration is going to be a great way to sort of double check our work and make sure that we are in basically the training zone that we intend to be in. Again, not everybody always has heart rate monitors and tubes for their athletes to breathe into to measure oxygen use. Some individuals will do spit tests or blood draws to check blood lactate concentration. And then just remember, we don't want to train minimally. We don't want to train maximally. We want to train optimally. And for optimal training, there are times where we will be maybe lighter and over here, and maybe at other times we kick it up and we're having higher intensities. But everything that we do should have a purpose and be a part of the game plan. If you go out and you introduce what you think is going to be a first day of programming, and on paper it's challenging but should be a little bit on the easier side, if you have athletes sort of falling apart and vomiting and basically just hitting a brick wall during the session, if maybe you don't react quickly and back off during the session, if looking back, if you think, okay, that program that I thought was going to be fairly friendly, maybe it was really up here, maybe it was really stressful. And so you can compensate by changing your subsequent programs and lowering that intensity. Because remember, we can't just redline indefinitely, because then we start more quickly finding ourselves, instead of in super compensation, we find ourselves going into negative adaptation. So a combination of using estimates and programming and logic, but also gathering feedback, can be a great way to create a well-rounded and productive program. And I bring back the resistance training relative intensity table because I find that it's quite relevant to what we're talking about now. And again, looking at that 100% max, looking at this 100% max, that could be maybe that's our VO2 max, maybe that's your maximal heart rate, maybe that's a 10 out of 10 on the RPE scale. Because then you can go from there and you can then follow similar training protocols and intensity zones to create programming that has highs and lows and more intense weeks and more base weeks and more volume weeks. So following similar logic from here, we're able to follow similar patterns when it comes to conditioning, and maybe we're outside the weight room. And I bring back this slide because I want us to take a moment to look it over and keep in mind that there are different muscle fiber types. Type 1 is more slow twitch and slow to fatigue. Type 2B is more fast twitch and quick to fatigue, but it produces a great amount of energy, is productive for sprinting and lifting heavy weights. And then type 2A sits somewhere in the middle and is also has the ability to transform and mutate a little bit more towards what we're training. So as we're thinking about what kind of training we might put athletes through, think about their needs. Think back to that needs analysis discussion we had early on in this program. Because although it may seem great and productive to really challenge our sprinters to put more miles on their shoes every week, if we end up challenging them to do things that are too similar to a type 1 muscle fiber athlete, then they're going to become a little bit more like a type 1 muscle fiber athlete. Their muscle fibers will actually transform and mutate to become more resistant to fatigue. but also to produce less explosive energy during contractions. And vice versa, if we're taking endurance athletes and challenging them too much to activities that resemble a type 2B muscle fiber, they're going to become more explosive and stronger, but they're going to fatigue more quickly. So let's keep that in mind when programming and when discussing programming. So let's look at a pyramid. And if we look at maybe the very base of a pyramid, what is that going to resemble a little bit? That might resemble more like your conditioning base for the needs of your athlete. So does a sprinter require or need a monstrous wide base? So does a sprinter who exists and they compete more in that top end of the pyramid, do they need to go out and do 10-mile runs that would maybe be more indicative of the base of the pyramid? Do they need that big, wide base of conditioning? I think you could argue no. And again, it depends on your coaching philosophy and maybe on the specific track events. And inversely, do our marathon athletes need to be running quick sprints and really working on their 3-point stance start for 40-yard dashes? Maybe not. But keep in mind that those energy systems are going to intuitively intertwine and work together. And an athlete who starts a marathon, they might sprint at the beginning, with that being in a big pack of individuals. So they may rely on that ATP PCR phosphagen energy system to get them out of the big pack so that they can sort of get some space to assess their pace and things like that. And also at the end of the marathon, after running 26.1 miles, individuals tend to run that last 0.1 mile as fast as they can. So what athletes will do, like a marathoner, is they will, when they're sprinting, they're going to use that ATP energy system. And then as they're still moving as quickly as they can, or perhaps they're downshifting a little bit when they're still in the first few minutes of maybe a intense run, like a competition or a hard training day, they're going to be in that glycolytic system. And then as they fall into their stride and maybe they're starting to get a handful of minutes into their run, they're going to exist in that oxidative system. And they're going to be limited, especially around that 6 minutes in mark. Maybe they've been training off of their maximal aerobic speed, so maybe it's more relevant. But around that 6-minute mark, I think we can confidently say that they're going to be producing energy off of their oxidative energy system. And so most athletes actually need a little bit of each of those different zones of work. But oftentimes you're able to achieve that by, even though you're still focusing on one zone more than the others. And inversely, let's say a football player where your typical play is about 4 seconds long. On paper, those athletes should be living and dying by their ATP, PCR, phosphagen energy system. But in reality, they produce some of that rocket fuel, that phosphagen rocket fuel, and then the play's over, and they have a little bit of an oxygen debt. They just burned all that energy in a short period of time, and now they're trying to replace that energy, and their heart rate's up, and they're breathing a little bit. So they're in that glycolytic system. And if there's a tough series of plays or maybe some unexpected turnovers, and if you're a high school player versus a college player versus a pro player, you might spend more time on the field or off the field. But let's say you're on that field for several minutes in a row. Let's say it's 6 minutes of fairly consistent 4-second plays, 4-second play, 30 seconds off, 40-second play, just repeat it over and over again. There's a very good chance that you're going to go from phosphagen to glycolytic to oxidative to phosphagen to glycolytic to oxidative. And you'll just be cycling through those energy systems the best you can. And so those athletes, again, they should also focus a little bit and have a stronger emphasis on their primary need. But that does not mean that they do not need to do training in other systems. And again, a refresher on the general adaptation syndrome. Although we're able to push our conditioning blocks, our mesocycles for conditioning may look longer and more aggressive than our mesocycles for resistance training, a very similar effect can still take place. Athletes can get burnt out. They can get overuse injuries. They just tend to happen a little bit slower than it does with an intense resistance training program. So if we're running nonstop, or that's our primary modality of training, there's plenty of injuries and issues that can spring up. Take a second to sort of look over this chart. And while you are, I would remind you that our nervous system can also come into play, especially if we are spending more time in the higher energy output of short intervals or speed work. If we are aggressive about that phosphagen energy system, that means that our nervous system is probably going to be putting out some rather high intensity efforts, and that will wear us down and fatigue us in a similar fashion as strength training or resistance training would. So I've been told that heart cancer is extremely rare. And I think about that when I think about the effects of conditioning on the heart, is that the heart, which is the, basically the central core of our ability to put out work, especially in the oxidative energy system, it sort of takes care of itself. It's not necessarily that the harder you work your heart, something negative will happen to it, as can be with maybe your spine during a lot of squatting. The heart sort of takes care of itself. It's pretty resilient, especially when you're talking about the lower and slower energy outputs. You're actually going to have some mutations. You're actually going to develop a larger ventricular load space. So you actually will be able to take on more blood into your heart per heartbeat, and your stroke volume will go up. So when we do longer, slower work, our heart will actually become better at it, and this helps lower our resting heart rate. So when I think about overtraining, I'm not necessarily worried about the heart, especially if you're doing lower and slower work as far as intensity or speed or your MAS score or your VO2 max. Now, if you're only going out and running sprints and you're doing that on a regular basis, I would worry about your nervous system, your muscles, and I would worry about your heart, because remember that we can also have a overdevelopment of the wall of the heart. That left ventricular wall can actually become overly developed, and this can cause heart problems. So these are a couple more reasons, our previous battery of injuries. I'm talking about the heart because I believe that this helps pay credence to why some of our mesocycles can last a little bit longer when we're talking about applying it to conditioning. And just a refresher on our energy systems and the times that they are correlated with. And again, a refresher on the energy systems that are related to different sports and the dependency of those sports on different energy systems. Again, I'll point out that skiing is a pretty even spread of 33%, more or less, into each energy system. Whereas diving is at 98% ATP PCR, 2% anaerobic glycolytic, and 0% aerobic. So if you're a diver and you are running for several miles every day, or 15 or 20 miles per week, that might help you stay mentally healthy. That might help your heart rate, your heart health. That might boost or assist with some goals you have with fat loss. But is it going to increase or boost your specific energy systems that you utilize for your sport? Not very much. A reminder, with this conditioning, I think too often the emphasis for strength training is let's test it and let's see how much stronger we can get our athletes. But with conditioning, a lot of times we just make people tired instead of train them. So if I want to get tired, sometimes I'll throw in my headphones and I'll just throw in my headphones and a hat and I'll go hit the street and I'll just go for 30 minutes. I'm not really worried about my performance. Sometimes I just want to break a sweat and kind of get tired. And that's okay. It's all about what you want to do. But if we are attempting to increase their performance and help them achieve goals, I would encourage us to test some of these things as well. Maybe not all of them, but something. Even just gathering your resting heart rate is not a bad idea. It's got to be the simplest low effort test there is, but it provides us with valuable data. Again, some conditioning styles, and not everything has to be done running. I want to keep reiterating that, especially if we are attempting to make a power athlete successful. If for some reason that they are interested in conditioning work, perhaps that conditioning work can be done in a pool where it's the legs and the arms that are working, or it can be an arm bike or some rope slams, or they have these rope climbing machines that are just on a loop. And so what that'll do is that will preserve their leg muscles to be more like type 2B, but their heart and their upper body can be training like type 1 muscle fibers. And that can have benefits as well. Another reminder about the Goldilocks principle. We can train differently at different times for different reasons. But what we don't want to do is drive those negative adaptations. And here's a little hodgepodge of some factors that you might take into account. You might use that RPE. You might use auto-regulate, which is auto-regulation, and you can also gather auto-regulation by surveys. You might use that maximal aerobic speed, like a 6-minute test on a track is a pretty easy way to assess. You can also do it off of a track. You can do it on a rower or a stationary bike. But then those numbers that you collect on a rower or stationary bike will really better relate and be used on a rower or stationary bike. I know that there's transition equations or correlations, but I would just say that however you specifically test it, I would stick with that modality for training. You might visit an exercise science lab and have your VO2 max gathered. You may just go off of charts and books. But I would encourage us to make sure that we are training and not just fatiguing athletes and just making them tired just because that's what was done to us as athletes. So if you're going to go out and have people run, have a purpose behind it. Have it be part of a game plan. And we also want our conditioning to be progressive. Not always getting harder necessarily. Again, there's times to back off and to regress it because that's part of the bigger picture. But when you are progressing it, I would often encourage you to only change one factor per progression. Whether that's decreasing the rest, increasing the intensity, such as whether you're going off of heart rate, their effort level, their speed, which could be, likely based on this conversation, their maximal aerobic speed, or the volume, such as length or time. And that is it for today, everyone. Thank you.